You're about to meet a little boy whose life today is nothing short of a miracle. Meet David Moore. To look at him, you'd never guess how his young life started 4 years ago.
How about we pretend he's a ghost taking a picture?
David Moore is a healthy, happy, rambunctious little boy, born with a congenital heart condition.
Well, basically he has half a heart because the left side doesn't work. So they've had to reroute all the blood flow of the heart to let the right side do all the work.
David's first surgery was at 9 days old.
The first surgery was called the Norwood, and during that surgery they had to start rerouting the circulation of his heart. So the surgeon, Dr. Austin, was able to connect his aorta, which was about half the size of a normal aorta, to the main trunk of the pulmonary artery. And then they also removed the wall between the top chambers of his heart. And they also put in a little artificial shunt to get more oxygenated blood to circulate to his body.
Dr. Chris Johnsrud is the electrophysiologist who keeps track of David's heart's rhythm and beat.
David Moore is a beautiful little boy who unfortunately was born with a very severe set of heart defects, but he got into the system very promptly, and he had some very, very fine cardiologists working to sort out his circumstances, and excellent surgeons to bring him through each of the different stages. There were some times that were touch and go, but you know, we never give up on these kids, and you can see, you know, the result today. A terrific little guy.
David's last surgery was in August of 2008. As you can see, he's recovered just fine.
You little bear Cardinals!
Now he's so smart and so funny and just vibrant. I mean, this child just lights a room up when he walks in because he has such an amazing personality, and he is just so sweet.
In the meantime, David's experience has caused a change in the direction of David the father's life. He has since entered nursing school.
Yeah, I want to work at Congenital Children's Hospital to help other families get through. I didn't have anybody to talk to when David was born. I didn't know what questions to ask or what to expect. When I walked in after David's first surgery with a hole in his chest, that was very hard for me because, you know, 4 hours or 6 hours earlier he was fine, and you walk in and he doesn't look like the same baby. You know, he has 18 pumps and monitors keeping him alive, and there's mothers around you that are losing their children and they're wailing and crying, and it's something that you'll never forget as a parent. Especially when a mother loses their child. I started in nursing school in January. I wanted to be able to help families, and I wanted to be able to be there hands-on and to be able to watch these kids grow up, and I want to be part of their family as Congenital Children's has become part of our family.
Several times in David's story, the Congenital Heart Center at Congenital Children's Hospital was mentioned. Here is an inside look at what they do for children and adults. Dr. Earl Austin is gearing up for a day of surgery at Congenital Children's Hospital. He's a cardiothoracic surgeon with the Congenital Heart Center.
Well, the Congenital Heart Center at Congenital Children's Hospital was developed to treat children and actually adults who were born with an abnormality of their heart. So we treat newborn babies and sometimes within the first hours of their birth, and we sometimes treat patients who are in their 50s or 60s who were born with an abnormality of their heart. They might have had surgery when they were younger, and then they've developed some problems as they've gotten older that still needs some kind of therapy. It might just need medical therapy.
Today's patient is a young adolescent.
I'm doing a chest reconstruction today. This is not an operation on the heart. This is a child who has a depression in his chest, and we're going to basically elevate the depression in his chest by putting a bar in.
This shows the scope of what the team at the Congenital Heart Center can do.
There are things that we can do surgically, and there are also things that we can do in the cardiac catheterization lab. So there are a number of things that we do for patients who are born with an abnormal heart. And nowadays, it turns out that We've had such success with treating babies and small children with congenital heart disease that now there are more adults with congenital heart disease than there are children with congenital heart disease.
A cardiologist like Dr. Whit Boone usually sees the patient first.
Well, I'm a pediatric cardiologist, and I'm a general pediatric cardiologist, meaning that I'm involved in diagnosing congenital heart disease and then providing care for children who have heart disease, both as an outpatient in the outpatient setting and as inpatients when they're hospitalized for procedures or for illnesses related to their heart disease.
He often follows patients into their adult years.
Children with congenital heart disease used to not live very long. And so the pediatric cardiologists really have the most experience in caring for those patients as they get into young adulthood.
Dr. Chris Johnsrud is director of the Congenital Heart Center.
My specific subspecialty expertise is in heart rhythm disturbances or arrhythmias. And the medical term for that is electrophysiology. The technological advancements in echocardiography or cardiac ultrasound have been tremendous. And the vast majority of defects, whether mild, moderate, or severe, can be pretty nicely described in the office with an echocardiogram. The other kinds of advancements that have occurred include things that we can do in the cath lab to diagnose and treat a number of these patients. So there are capabilities now that were not available 10, 20, 30 years ago to handle a great deal of these.
These physicians are part of a team that make up the only center in the area dedicated to treating children, adolescents, and young adults with congenital heart defects, patients like David Moore.
I think the thing that strikes me most about what we do here is the teamwork that's involved. What we do, especially for kids like David, kids with very complex sorts of problems, what we do takes so many different actors doing their jobs well to make a success of these surgical procedures and other procedures we do.